Welcome. I am Terry Tropin, and today I'm discussing steps to select diagnosis and procedure codes for an operative report. First, let me tell you a little about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I am also a HEMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These books are study guides that help summarize the guidelines and make them more clear. My books include one on E&M coding, ICD-10-CM coding, ICD-10-PCS coding. These are available on Amazon and updated every year. I have these two updated for 2022. So here's an overview of what we're going to discuss. We're going to talk about the steps to code an operative report, and we're going to present a sample op report, and then kind of take it apart. Look at the diagnoses codes. Are there any guidelines that apply here? Are there any notes, excludes one or excludes two notes that apply? And then we're going to get to the procedure coding and look at any guidelines that may apply there. So here is the operative report we're going to be coding. This is actually much shorter than the ones typically seen, but in a YouTube environment, it's difficult to code a multi-page report. So here's the report. 6 months ago, the 71-year-old obese due to overeating Black male patient was seen with complaints of chest pain and fatigue. The physician performed an ECG, which confirmed sick sinus syndrome with bradycardia. The physician prescribed conservative treatment using medications, and a Holter monitor was used to track his irregular heartbeat. The condition seemed to be worsening, however, with increased pain and fatigue. Therefore, it was decided to implant a pacemaker. BMI is documented by a nurse as 33.4. Patient undergoes a placement of a dual-chamber pacemaker. An incision was made and a subcutaneous pocket in the chest wall area was created. The Medtronic's Azorb Model W1D401 generator was placed in the subcutaneous pocket, and the incision was closed using 3/0 silk sutures. Both the right atrial and right ventricle leads were placed percutaneously. Appropriate pacing parameters were obtained and programming initiated. Hemostasis was achieved. The patient tolerated the procedure well, and there were no complications. Okay, so the first step is underlying important words. Operative reports typically include a lot of information that will not affect the code or the codes chosen. By underlining words, you pull out the information you need and don't have to read the report over and over again to make sure that you've got everything covered. Well, your next question is, how do I know what I need to select a code? This comes from practice. As you become more familiar with codes and guidelines and how the system works, you'll be more familiar with what information is needed for coding, and you'll know what to underline. So look, for example, for codes indicating a diagnosis, a late effect, a sequelae, residuals, any due to, a metastasis, primary, in situ, these kind of words, history of, status post, previous, that kind of thing, whether something is described as acute or chronic. Now for symptoms, you need to say, underline them, but then you're going to go back and say, is this symptom related to the final diagnosis, or is it independent? If it's related to the diagnosis, the guidelines say don't code it. If it's independent, then you're going to code it because it may indicate another condition. For procedures, you're going to look for any codes that indicate the type, the approach, and the device. So here's the words that we underlined. Obesity is important because it can make the surgery riskier. So we're going to code obese due to overeating. And we're going to code sick sinus syndrome with bradycardia, the BMI, and then placement of dual chamber pacemaker, the generator, and the leads. Now, it doesn't matter that this patient is 71. It doesn't matter that he's Black. It doesn't matter that he's male. So, and also you know that all of this was from a previous encounter. So we know the patient is obese and that carries over. But other than that, and that sick sinus syndrome, but the fact that they're getting medications, the fact that they had a monitor, the fact that they had ECG, that's all from the previous visit, and we're not going to code those at this point. Now see here, physicians love to put this kind of thing, Medtronic Azure model W1D401, but we don't need to know that. We don't need to know what kind of sutures were used, okay? So these are the words that we need. So here are the words that we underline. So we pull those out, and this gives you the information you need to code. So out of that long op report, this is what you need. So this we don't need. Pain and fatigue, that goes along with the sick sinus syndrome. So this is what we have for diagnoses, and this is what we have for procedure. So we've already broken it down a lot so that it's a lot less. So let's start with the diagnosis for sick sinus syndrome. This condition is not, as you might expect, related to the sinuses in the head. It relates to the sinuses in the heart. A sinus is any sac or cavity in an organ or tissue. So sick sinus syndrome is a problem with the sinoatrial node, which is up here, and it can result in either bradycardia, slow heartbeat, or tachycardia, fast heartbeat. In fact, it's sometimes even referred to as tachybrady syndrome. Now, we also know that surgical treatment was provided at this encounter. Okay, so how do we find the code? Let's turn to the alphabetic index under syndrome, sick sinus, or you can also look under sick sinus parentheses syndrome. Either way, you get to I-49.5. Now, if you look up sinus, there's not going to be any entry for that. So in the alphabetic index, look up something one way. If you don't get something that satisfies you, that seems to fit, say, how else can I look this up? And then look it up another way and see if you can find it. So you can look at either under syndrome or under sick. Sinus is not going to help you. So are there any guidelines that apply? So we're going to turn to the guidelines for cardiovascular system. There's no specific guidelines, so we're going to turn to the code I-49. Remember that it's important to look up the code in the tabular list and not just use the alphabetic index. There are important notes and tips that you will miss if you don't go to the tabular list. For example, in the code category I-49, other cardiac arrhythmia, there are these notes. Code first, cardiac arrhythmia complicating abortion, obstetric surgery. Well, remember that this patient is male, so none of that's going to apply. There's these excludes one notes, mean you can't report these together, and none of those are documented. And there's an excludes two for bradycardia. Okay, now we said the patient had bradycardia due to the sick sinus syndrome. So remember, excludes two means you may use two codes if it's documented. But it's kind of confusing because you see bradycardia NOS R00.1 as an excludes two, but you also see R00.1 under excludes one. Sinoatrial bradycardia, sinus bradycardia, vagal bradycardia. So that doesn't make any sense. So it all depends on how it is documented. So let's look under code R00.1. Maybe that will help clarify what we need. Yes, it does. There's an excludes two note under R00.1 So it excludes 2 specific arrhythmias, and it gives you I-49 to I-47, I-49, which is the code we were looking at for sick sinus syndrome. So therefore, this means that you code the I-49 code and the bradycardia. Remember, the sick sinus syndrome can be bradycardia or tachycardia. So this specifies, in this case, it's bradycardia. So that means we can code both. Okay, so we got that diagnoses. Let's look at the next one. The next diagnosis is for obesity. In the alphabetic index, find obesity due to excess calories, that's the overeating, which refers you to E66.09. The indents under this category in the tabular list for morbid obesity, or actually in the alphabetic index too, morbid obesity, severe obesity, but we don't have that documented, so we're going to stick with the E66.09. But it's good to kind of look around and make sure that there's nothing more specific in the index or in the tabular list. So we go to the tabular list, E66.09. So what kind of notes do we have? Well, under category E66, overweight and obesity, it says code first obesity complicating pregnancy. Well, again, this is a male patient, so that's not an issue. But there's also this note, use the BMI if known. Well, we do BMI that was documented by the nurse. And I've excludes 1, but none of those are documented, so that doesn't apply. But it's still a really good idea to look around because you just never know. It may give you some really important information. So let's go to the Z68 for the BMI. So if you want to, you could go right away because it refers you to that, or if you want to go back to the alphabetic index, you look under body mass index, adult, 33.4, and this refers you to Z68.33. Now there are lots and lots of notes in this category. So let's look at in the tabular list. So let's look at these. So the notes under category Z68 defines adult versus pediatric. You'll see that there's a bunch of different codes, and they'll say adult BMI, pediatric BMI. So when do you become adult? Well, according to this, you become an adult when you're 20 or older. A pediatric patient is coded for patients ages 2 to 19. And it also tells you where did these numbers come from, and they're based on the growth charts from the Centers for Disease Control. If you have kids, you've probably seen this chart, and here is the age up here, and this is the weight down here. So this gives you the average weight, and they say your kid's too thin, your kid's just right, your kid's too fat, whatever. So this probably looks familiar to you. Now, should we report obesity and BMI? In the front of your ICD-10-CM book, there's section 2, which gives you guidelines on additional codes. Obesity is often a condition that impacts the treatment given, so obesity certainly affects the chart. So in the official coding guidelines, it says other diagnoses means they are clinically evaluated, they're therapeutically treated, their diagnostic procedures related to it, extends the length of stay in the hospital, or increases nursing care or monitoring. I would say since the BMI was taken as clinical evaluation, okay, and I think that it also complicates the surgery. So I would definitely do the obesity and the BMI. Okay, under BMI Z68, there are a bunch of tips. This states that the BMI can only be reported with associated diagnosis, obesity, underweight, anorexia. So you can't do BMI without a diagnosis that's related to it. It also states that BMI can be reported by other clinicians, other providers, like nurses, dietitians, and such. And it must meet the definition of reportable diagnosis. What does that mean? I think we kind of talked about that on the previous slide. That makes it reportable. So there are other guidelines, and these are kind of hidden because they're not in the section for endocrine, which is where overweight is. They're not under the Z code where the BMI is. They're in the general coding guidelines. So these guidelines list a number of conditions that may be reported by people other than the patient's provider. And one of these listed is the BMI. And the guideline states that you can do the physician has to document the patient is obese, overweight, or underweight, or other related condition, but a nurse can then document the BMI. But you can't document the BMI without the physician doing it. So this is kind of lost because it's not where you might expect to find it. So let's look at the codes we've selected so far. Sick sinus syndrome, got it. Bradycardia, got it. Obesity, got it. BMI, got it. So we have the diagnoses. But the next question is, which code are we going to list first? So if you go to the front of your book, ICD-10-CM book, Section 2, Selection of Principal Diagnosis. This is after all of the specific guidelines for specific chapters in ICD-10, and then that's all Section 1. Section 2 talks about principal diagnoses. A principal diagnosis is defined as that condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. Why is the patient being brought in? Well, they're not being brought in for the obesity. They're not being brought in for the BMI. They're being brought in for the sick sinus syndrome. So I-49.5 is listed first. So let's move on to the procedures. Here is the statement in the operative report for the procedures. Patient undergoes placement of a dual chamber pacemaker, generator placed in the subcutaneous pocket, and right atrial and right ventricle leads were placed percutaneous. And all this other stuff is important for documentation by the physician, but not for selecting a code. Okay, so we have 3 procedures. Generator placed in subcutaneous pocket, and that's here. Cardiac lead placed into right atrium. Cardiac lead placed into right ventricle. This was surgery, so we know the first digit is automatically a 0. So we did generator placed in subcutaneous pocket, cardiac lead placed in right atrium, cardiac lead placed in right ventricle. So this looks like the root operations insertion. Let's check this into the Appendix B, which defines each root operation and gives examples. The examples in this appendix are so helpful. So insertion is defined as putting in a non-biological appliance, yep, that applies, that monitors, assists, performs, or prevents a physiological function. It assists in this case, but not physically take over the place of a body part. So insertion seems to be the correct one, but it never hurts to double check. So if you go to the index, you see there are 2 different main terms for insertion. One is just insertion, and one is insertion of device in. So we're using a device, so it's going to be insertion of device in. But just be aware, don't let this throw you, that you look at insertion and it has these things which are totally unrelated to what we're doing in this case. Let's start with the insertion of the generator. In the PCS index, find insertion of device in subcutaneous tissue chest, and that gives you 0JH6. So that gives you the table we're going to, 0JH, and it gives you that first digit, okay? Now, you can also look up pacemaker, dual chamber, chest, and you're referred to 0JH. So again, this is two different ways, but they're both taking you the same place. So you turn to this table, 0JH, body part is 6, they already gave you that up here. Percutaneous, dual chamber, no qualifier, and there's no other option other than Z for the qualifier. So the full code is 0JH636Z. Don't be thrown off by the fact that the table 0JH is continued onto 2 pages. So you go through the page, the first page of insertion, you go, it's not here, it's not here. Sometimes the table will continue on to another page, and that sometimes throw people. So putting it all together, we have 0JH636Z. Okay, so the next procedure is insertion of the lead into the right atrium. So go back to the index, insertion of device in atrium right, which refers you to 02H6. Note that the insertion device into heart in the index refers you to 02HA, which is insertion of a device into heart. Doing it into the right atrium is much more specific, so we're going to use this one. You want to use the most specific body part value that you can. So insertion to right atrium, so you turn to that table 02H and you find that body part value 6, approach is 3, that device is cardiac lead, that's a J, and then a Z. So the whole code is 02H63JZ. So the next final procedure is insertion of the lead into the right ventricle. Note that this is the same except for the body part. This is insertion of lead into heart is the same, except that this one was right atrium and this body part is right ventricle. So you can just go ahead, you've got 02H63JZ, and just cross out this one and substitute this one, and you've got the body part. Now, if you don't feel comfortable with that, you can go back to the index. So look up insertion device in ventricle right, which gives you 02HK, turn to table 02H, you've got ventricle, percutaneous, cardiac, no qualifier, and that takes you to 02HK3JZ. Okay, so let's look again. Do we have everything covered? That's a very important step. Insertion of generator, OJH636Z. Insertion of lead to right atrium, 02H63JZ. Insertion of lead, 02HK3JZ. Okay, we said we had 3 procedures. We got 3 codes. We are good. So let's look over the operative report. Look at what we've underlined. And so you have final decision. Diagnoses, I49.5, R00.1, E66.09, C68.34. Procedures, 0JH606Z, 02H63JZ, 02HK3JZ. So we have it. Wow, this is a lot, and it took some time to come to these codes. Remember that the more you code, the faster you get. And if you take it down into step by step by step, that way you're sure to cover everything. The more you code, the faster you'll get. You'll be able to complete these steps more quickly, or maybe even skip some. Also, if you underline, highlight, write in notes as you go, it will make the process much easier. So anytime you refer to a guideline, make a note or highlight it so next time you see it right away. For diagnosis coding, under category I49, circle that excludes to note Bradycardia NOS R00.1. Under code R00.1, circle that excludes to note specific arrhythmias. That's how we knew for sure that we needed to do the bradycardia and the sick sinus. So under category E66, circle that note about adult pediatric and write in the information, since that was one of those guidelines that was not where you might expect it. Write in, provider must document related condition. Other clinicians can document BMI. In this case, it was a nurse that documented the BMI. Okay, what about in your PCS book? We didn't talk about all of these, but it's important to note the appendices. And lots of times in books, people don't pay any attention to the appendices, but for your coding books, particularly your PCS, it's really important, particularly this one, this one, this one, particularly those. But the rest of them may also be important depending on what you're doing and how complicated the op report is. So make a note. Remember that these appendix are there and make notes in them, okay? So you might want to make a note in the root operations under insertion that that's where pacemakers are coded, for example. So anytime you do something and you go, wow, that's not the root operation I would have expected it to be for this particular case, write it in under there. Lots of good examples there. Another good reason to go into root operations because it gives you examples, which are so, so helpful. So that's the end of this video. Be sure to look for the other videos. There's another op report video out there. If you enjoyed this video, please hit the like button and click on my picture in the lower right hand corner to subscribe. Thank you very much.